Now we're going to discuss poisonings, ingestions, and accidents. There are some basic things that we need to know in our approach. Poisonings are the fourth most common cause of accidents in children. You need to remember there are several age groups that are highest risk for poisonings and ingestions. Less than 5 years of age, because children are exploring everything and putting everything into their mouths and don't know any better. These are considered accidental ingestions. Older children are considered non-accidental or intentional ingestions. So adolescents may just be experimenting with several drugs, or they may have suicidal tendencies or whatever. And also you can see in older patients, but outside of the pediatric range, in the elderly population, you can sometimes have accidental ingestions simply because they may have forgotten to take their medicine, and so they take another pill, or they just want relief sooner, things like that. We're just going to deal with the pediatric ones, though. The majority of poisonings occur in the home because that's where everything is. Many times, poisonings occur during times of change. So, for example, if a family is on vacation, they may be visiting somewhere and that house is not poison-proof or child-proof. Sometimes people are moving, and so things are in boxes and things haven't been put away properly, and that's when the child can get into things. Those are higher risk times also for poisonings and ingestions. Prevention is probably the most important thing that you can do, and it's part of anticipatory guidance, and it's part of a developmental problems with children. In normal development, we need to know that, because that way we can anticipate when the child will do certain things, and we can talk to the family about preventing. So you want to lock up cabinets, you want to plug up your outlets and things like that. Medicines should be kept out of reach of the child. Unfortunately, many of the products that we use at home, such as cleaners, are placed under the sink. Well, that's about the right height for that child. An 18-month-old is about the size of the height of the sink. So they can, it's right in front of them when they open the door there, and they can get into things. So things should be out of reach of the child. Cabinets should be locked up. Everything should be geared to making it difficult for that child to get into a cabinet or a drawer, so that they get frustrated and they go somewhere else and find something else to do, or you happen to walk in and catch them trying to get into something. That's one way of preventing it. Another thing that you can do is get rid of expired medications. If they've already expired, flush them down the toilet. Don't leave them out there so you can get to them. Do not take medicines in front of the child. Do not refer to medicine as candy, because these are all things that will invite the child to go ahead and take something. First aid, the medicine should be, or whatever the child got into, it's best if it's already labeled, and you can call poison control. If it's something that got onto the child, it's best to just wash it off, but you should always call the Poison Control Center for basic things to do. There are certain times that we do not want the child to vomit, and that could make things worse. In the emergency department, we always talk about airway, breathing, and circulation. That's the first priorities, is ABCs. Emesis is not as popular as it used to be in children. First of all, we know that giving emetics like Ipecac don't help that much. It's only best given within half an hour of the ingestion, and so we don't get as good results as we thought we did, so we really don't use emesis much. There are certain times that we absolutely, positively do not want to use emesis, especially if they had some kind of corrosive acid or alkali. You don't want that stuff coming back up and causing more problems. If they actually ingested a sharp object, you don't want something sharp working its way up the esophagus again. If the patient is obtunded or comatose, you don't want to induce vomiting, because then they can aspirate. So those are absolute contraindications to emesis. Also, any child under 6 months of age, you do not want to use Ipecac. Gastric lavage is recommended only in older children. Gastric lavage implies putting an NG tube down into the stomach, and it has to be big enough to be able to suck out pill fragments. Well, younger children actually have small nostrils anyway, so you have to put in a smaller tube, and you're probably not going to get any pill fragments out. So it's really not recommended in younger children. Older children, you can use it. Again, you don't want to use an NG tube, put it down into the child if they are obtunded or comatose, because they may vomit and they don't have protective reflexes, and they can aspirate. Charcoal can be used in many situations. One thing to remember is if you're giving charcoal and then there's some kind of oral antidote, you can't give them because the charcoal will probably adsorb to the oral antidote and decrease its effectiveness.